Hey, you guys, welcome back for another week of Work It Out Wednesday, where we work out a practice question. This week, we've been talking about the pediatric integumentary rashes, six of the most common ones. So if you haven't had a chance, go check out the video from yesterday where we quickly go through each of those. But let's test your knowledge and see how you do. So the first question states Miss Kelson presents with her 3-year-old son, stating that he has been crying due to a sore mouth. As the nurse practitioner completes an assessment, it is noted that there are sores to the mouth and some to the patient's feet. What is the best diagnosis? Is it A, rubella, B, hand, foot, mouth disease, C, roseola, or D, rubeola? All right, you take a few minutes and tell me what you think in the comments. All right. I always tell you guys to read the stem of the question first. The stem of the question states, what is the best diagnosis? So you need to figure out what we even have here based on the presentation so that we can come up with a diagnosis, right? So this is a 3-year-old child. He has been crying about a sore mouth. Nurse practitioner notes sores in the mouth, sores on the soles of the feet. So what is that when you're considering diagnosis and you're thinking about those integumentary rashes and common things for the pediatrics? Is it rubella? No, they don't typically have the sores in the mouth. Is it hand, foot, mouth disease? Yep. Hand, foot, mouth, they'll have the sores commonly in the insides of their cheek on that buccal mucosa. They commonly have it on the palms of their hands as well as the soles of their feet. All right. Question number 2. Miss Cox presents with her 9-month-old daughter, stating that she noticed this rash on her trunk. The nurse practitioner notes a macular papular rash to the patient's chest. The mother states that recently her daughter had a fever that was treated with ibuprofen, and she's been doing well until she noticed the rash. What is the best diagnosis? Is it A, rubella, B, rubeola, C, roseola, or D, Fifth disease? Tell me what you think. All right, again, this stem of the question is asking what is the best diagnosis. So let's look at how the person is presenting. So this is a 9-month-old little girl, has a rash on the trunk noticed by the mother. The mother said that she had a high fever, has been doing well other than this rash. The nurse practitioner looks at the patient, does note a macular papular rash to the trunk region. So here, this is classic for roseola. Roseola, patients will present and is more commonly on the trunk with that macular papular rash. So be clear that you are knowing those key identifiers because that's the key for roseola. And the other key indication was she had a fever. So typically what happens is the patient will have a high fever, it has resolved, and then they'll get a macular papular rash, commonly on the trunk, but it will resolve on its own. If you are having trouble with these, go check out the video from yesterday. But if you found this helpful, as always, make sure that you like, comment, and subscribe, and share with someone who else may benefit from this. But meet me back here next week to test your knowledge. We are covering diabetic medications next week. I get a lot of questions on that, so be sure that you are here for that. And then tomorrow we'll be doing a soap note. As you know, we've been doing that series for this month on pediatric rashes. So we'll do one on one of these scenarios that we have covered for today. Okay. All right. Meet me back here. Bye, y'all.